My name is Nathália Desiderio and I will present neurological manifestations in patients with severe COVID-19, a scientific initiation with Fábio Teodoro de Souza's advisor and financed by PUC-PR. The coronavirus is not just restricted to the respiratory tract and promotes a lot of systemic manifestations, including neurological manifestations that can be linked to the central nervous system with headache, convulsion, lowering of the level of consciousness and acute cerebrovascular disease, or the peripheral nervous system with olfactory and taste disorders. Our objectives: to analyze which neurological manifestations are most present in patients with severe COVID-19, hospitalized in an intensive care unit using invasive mechanical ventilation, and to analyze who is the most affected population and if there are predisposing factors for neurological conditions in COVID-19. We performed a systematic literature review according to the flowchart. So we included 15 studies in English or Portuguese between the years 2020 and 2022, published in scientific journals, editorials, and case reports. Studies that present patients with neurological symptoms only after confirmation of COVID-19 and these symptoms just during hospitalization. And we used the descriptors neurological manifestations and COVID or neurological symptoms and COVID. About the results, we analyzed the most prevalent neurological symptoms in patients with severe COVID-19 are the olfactory and taste disturbance, with 25 to 68%, followed by headache, 13 to 60%, convulsion, 5 to 29%, delirium, 3.3 to 19.3%, and lastly, cerebrovascular accident, 0.4 to 4.9%. In smaller numbers, cases of meningoencephalitis, encephalopathy, Guillain-Barré syndrome, Miller-Fisher syndrome, and posterior reversible encephalopathy syndrome are still reported. Olfactory and taste disturbance are more specific symptoms of COVID-19, and these symptoms, as well as self-reported symptoms, are related to a better prognosis of the disease. Cerebrovascular syndromes are related to longer hospitalization and higher risk of death. About the population, the most affected population are white men between 45 to 70 years of age with previous comorbidities, hypertension, diabetes, obesity, cardiovascular disease, and active neoplasms. And we analyzed that patients with neurological manifestations during hospitalization had longer hospital stays, with an average of 3 days longer than patients without neurological symptoms. And the final considerations: milder symptoms such as olfactory and taste disturbance and headache are the most common in hospitalized patients, even though cerebrovascular disease such as stroke have a high incidence, up to 4.9%. And the presence of any neurological symptom increases the length of hospital stays, and cerebrovascular disease increases the higher risk of death. Thank you so much for everybody.